Welcome to Compass Points, the weekly podcast for CompassKnox.com. CompassKnox.com is your best source for news and politics in Knoxville and Knox County. Your hosts today are Scott Barker and Jesse Mayshark, the founders of CompassKnox.com. You can find their daily in-depth coverage and subscribe at CompassKnox.com. The Compass Point podcast is brought to you in conjunction with Almost an Agreement. Almost an Agreement is a layman's attempt to get a handle on the workings in government and politics that we deal with every day. Check them out at almostanagreement.com or subscribe for free on your favorite podcast provider. If you'd like to learn more about the topics discussed on today's podcast, go to CompassKnox.com and subscribe for in-depth coverage and much more. And now, here are your hosts, Scott and Jesse from CompassKnox.com.
Welcome back to Compass Points, the weekly podcast brought to you by the fine folks at CompassKnox.org, reviewing news and events in Knoxville and Knox County. Special focus on politics, government, education, and business. I'm Jesse Mayshark, and as always, joining me is my cohort, Scott Barker. Scott, how are you doing today?
I'm doing just great, Jesse. How about yourself?
I'm fine. Viewers and or listeners to the podcast may notice that once again, Scott and I are not in the same room for this recording. Last week, that was because of COVID isolation. Exposure isolation, I should say. There was no actual COVID case that we know of. This week it's for a different reason, which we will talk about in just a minute. But Scott, to get us started, let's talk about what happened at the University of Tennessee this past week. There was an announcement having to do with compensation. What was it?
Absolutely. UT President Randy Boyd told the executive committee of the Board of Trustees that UT Knoxville Chancellor Don D. Plowman would be getting a nice raise, about 24%, based primarily on the increase in new enrollments, been going up about 3.7% a year the last 2 years, and she's getting a hefty raise from about $660,000 a year to $820,000 a year. Now
she's getting up into coach range.
She's she's not quite there. She's at least not. She's not in football coach range.
Right. Depends on the sport, I guess.
Absolutely. But what it also does is it does put her in the range of her peers at what the university considers its peer institutions. They're comparable peers, and those are schools that UT considers themselves kind of on par with right now. That's universities of Alabama, Kentucky, Nebraska, South Carolina, Auburn University, LSU, those North Carolina State, those schools, and they consider those comparable peer institutions. And she is a little bit above the average compensation for the campus president or campus leader of those schools, regardless of title. UT also has what they consider aspirational peers. Those are schools they want to be more like as far as academic reputation and that sort of thing. It was Florida, Wisconsin, Michigan State, Purdue. Those are the some of the aspirational peers. She's a little bit below them, so she's so the compensation actually puts her pretty well in the mix of what campus leaders get paid at schools that UT measures itself against.
Mm-hmm. And of course, there was some predictable. Every time administrators get big salaries or raises, of course, there's some commentary from faculty who tend to be paid a lot less. about how equitable this all really is. But the thing that I think is most telling about this is that this recommendation obviously came from UT President Randy Boyd, and to me it seems like it's a sign of the relationship that Boyd and Plowman have. They have seemed to be very close ever since. I mean, of course, Boyd was among those who hired and approved of Plowman's hiring. But it seems like a couple years in that relationship is pretty strong.
Obviously, until recently, their offices were in the same building. I think it does show that he has a lot of trust in Plowman. He didn't have to go to the board to get approval for this. He made this decision on his own. He didn't have to convince the trustees that she really deserved it. He just made this decision unilaterally. He's allowed that. That's fine. From a procedural standpoint, I think that he one of the things that he's been emphasizing lately is increasing the number of graduates. He was the architect behind Governor Bill Haslam's Drive to 55, which is a goal to get 55% of Tennessee adults with a post-secondary degree by the year 2025. The state's made progress, but isn't there yet. He's really wanting to push that. And by increasing enrollment had been going up about 2% a year before Plowman arrived, and now she's getting it up to about 3.7%, and on an annual basis. Those are new. That's growth. That's new applicants that are coming in. So, and that's now that UT Knoxville is the #1 school in the Southeastern Conference for growth in enrollment. So that really plays to what Boyd has really emphasized. So I think that's a reflection of that as well.
And of course, that president-chancellor relationship can be fraught, has been fraught many times in the recent past. Even the Plowman's previous, the previous chancellor to Plowman was dismissed by the previous president in a very public and fairly vitriolic exchange. So it's interesting to see that relationship with Boyd and Plowman appears to be much stronger. So let's move on. The reason that you are calling in remotely this week is that we're taping this on Friday, and something else is happening Friday that you are also covering. What's that?
That is the city council's budget hearing. They have, under the charter, between the first reading of the budget and the second reading of the budget, they have to have public hearings. They're doing that right now. Taking a break in it. I've been covering it remotely this morning. I'll be heading down to the city county building for the afternoon session. They're going through department by department. The various department heads are making their cases for their budget requests that are included in Mayor India Kincannon's budget proposal. So they're getting grilled by council members who are digging pretty deeply into those numbers.
And we will have full coverage of those hearings, including the public forum, which is coming up at the end of the day in Monday's Compass.
Yeah, that's right. The public will have a chance to weigh in. Of course, Mayor Kincannon has proposed a property tax increase for next year. I don't know how many people will be down there, but property tax increases tend to bring out some people who don't like that, and I'm sure that there will be some who will speak. It will be interesting to see kind of how that goes. One of the things that the administration has emphasized early on in the hearings is that, excuse me, the of course, we're going through the reappraisal process, and the equalization of that will happen in August. And what that will do is it will effectively lower the property tax rate once they set it at whatever level they set it at this month. So they're really emphasizing that while they're proposing a 50-cent tax increase, or rate increase, now that will end up being about a 35-cent increase after equalization. It's a very complicated thing, and typically property tax increases aren't pushed through during reappraisal years, but it just adds an added complicating factor. One of the things is the driving force behind this, of course, is the restructuring of salaries within city government and pay increases for city employees. That's going to account for about 80% of the property tax increase. And the questioning is basically the council members asking the department heads to justify that. And also, one of the things that's interesting is Vice Mayor Andrew Roberto is asking them what would happen if you didn't get that. And so don't know exactly what that means yet, but I'm sure that there will be some discussions about the property tax increase proposal as we move forward.
Sure. Well, and speaking of property taxes, we ran an analysis this past week at Compass, which people can find on our website at compassknox.com. Actually, this particular story, we have moved outside our paywall, so even if you are not a subscriber, you can go there and read this story. Really trying to get a handle on what has happened with property taxes in Knoxville and Knox County over the past decade, because I think as we look at a proposed tax increase, it's important for people to understand how much they're actually paying now. How much are they paying now compared to 10 years ago? And as we have talked about on this podcast before, and as we've certainly written about, property taxes are complicated because, as you say, they have a tendency to go down. Tax rates have a tendency to go down over time because every time there is a countywide reappraisal and the valuation goes up, then the rates have to be adjusted down so that the city and county are getting the same amount of actual tax revenue as they were before the reappraisal. And that could theoretically make you think that, say, in the absence of a tax increase, that just keeps everybody's taxes flat. But that's not really what happens, because inflation actually tends to go up faster than property taxes keep pace with, sometimes even if there are tax hikes. And so what we did in this analysis was look at 50 properties, 25 outside the city and 25 inside the city, and then kind of look at what people were paying in 2010, look at what their bill was last year in 2021. And what we found, which I thought was interesting, though not really surprising, was that outside city limits, where there has been no tax increase during that period, just about everybody is paying less in taxes once you adjust for inflation than they were in 2010, and sometimes significantly less, ranging from maybe 5% less to up to 30 or 40% less. It really it varies a lot depending on the individual property and the appraisals that people have. And then inside the city, where there has been a property tax increase, there was one in 2014. Even there, especially when you look at the combined city and county property tax burden, most people, 19 out of 25 that we looked at, were paying less. And even if you just look at city taxes, where there has been that tax increase, still most people, 16 out of 25, were paying less in city taxes than they were 10 years ago once you adjust for inflation. What does that tell you?
Well, that tells me that inflation is a huge force that people don't really think about, and they don't account for it. It would be really interesting to go back 20 years, because the county hasn't raised taxes since 1999, so it would be out in the outside the city limits, sure they're paying much less than they were even then. So it tells me that that inflation is overlooked frequently when we discuss property taxes and property tax bills that people end up paying. And it also kind of gives credence to the idea that every now and then governments will have to increase their property tax rate to make up for inflation. One of the things that is included in the city's property tax increase is it's built in to accommodate inflation. Like I said, about 80% of it's going for salaries and compensation, which of course they want to increase in part because of inflation, but also the about 9% or 18% of the increase is going toward inflation in the coming years. So it's something that you have to account for if you're accounting and you're in the finance departments of these governments, but the average person might overlook.
Yeah, and I think it's, for example, we looked at the property tax bills being paid by our two mayors, City Mayor India Kincannon and County Mayor Glenn Jacobs, and of course he lives outside city limits. She lives inside city limits. She also lives in 4th and Gill, which is a neighborhood that has had tremendous property value inflation over the last 10 years. And because of that, the assessment on Kincannon's house has gone up even more than the rate of inflation, because those houses in 4th and Gill, as anybody knows who's looked at property there, have gone up tremendously in value. And so even adjusted for inflation, we found that Kincannon is paying about 42% more in property taxes than that property was paying 10 years ago. But Jacobs, who has a bigger house and a house that's appraised at a higher value than Kincannon's, actually outside the city, his property tax bill, that property's bill in 2010 was $1,819. And in 2021, it was $1,832. So over 11 years, you only have about a $13 increase in property taxes, less than 1% increase. And of course, inflation rose by about 20% over that time. And so Jacobs is functionally paying about 17% less in property taxes than he was 10 years ago. Of course, that's not his fault. That's true of all properties, many, many properties outside city limits. It's just an illustration of the way that the revenue that those property tax rates produce actually erodes over time. And absolutely, it's something that affects the bottom line in our local governments. So also, this past week, we had a really interesting meeting involving multiple local governments, and it's also the subject of our podcast interview segment this week. Scott, you want to set this up?
Yeah, last Monday, the members of the Knoxville City Council, Knox County Commission, and the Knox County Legislative Delegation met to discuss mental health issues in Knox County. And also the Commissioner of Mental Health for the state of Tennessee showed up and had a wide-ranging discussion about all the various issues facing providers in the community at large on when it comes to mental health. And our guest this week is Ben Harrington. He is the CEO of the Mental Health Association of East Tennessee and knows the whole landscape of mental and behavioral health inside and out. So without further ado, let's go to our interview with Ben. Hi, our guest this week is Ben Harrington. He is the CEO of the Mental Health Association of East Tennessee, and he's here to talk to us about the mental health situation in the region. Ben, welcome. Glad you could join us.
Thank you all. Happy to be here.
Great. One of the reasons that we wanted to talk to you this week is on Monday of last week, we had a joint workshop with City Council, County Commission, and members of the Knox County Legislative Delegation. It's kind of an unusual event to have people from all three bodies in one place. I think it may be the first time that's happened, at least in a long time. And I wanted to ask you, first of all, kind of what that means, what your impressions were of the meeting in general.
Well, I think it is really a monumental undertaking to get all three bodies in the same room to focus on one subject. And so we really have to give kudos to Becky Massey, Vice Mayor Roberto, and Chairman Richie Beeler for their leadership in this. But what it also says is the process that Mayor Jacobs undertook starting last summer, when Commissioner Jay was still chairman of Knox County Commission, was really fortuitous and the right thing to do, because by the time we got to Monday's meeting, the report was already in the works and they knew it was coming, and hence in March they'd already said, we're going to have this state of mental health report, and it's going to speak to issues that each of those elected bodies should be concerned about. And so it really became a monumental deal. It really validated the county commissioning the MHA to do that report. It validated our work, and I think validates the distinct need to keep the process working, keep those channels open to keep working and having dialogue on specific issues within the broader context of mental health in the community too. So I'm excited about that process and glad they're all at the table.
Great. Well, thanks. We'll get into more of the report in a moment.
Mm-hmm.
First of all, I wanted to ask about the meeting. One theme kind of emerged for me as a reporter covering this, is that with the new facilities coming online, we have two new hospitals. One's already open, one's getting ready to open. Next week, Children's Hospital is going to be opening a unit for children with mental illness issues. We have the city-county clinic that is proposed for the St. Mary's side in North Knoxville. We've got other programs that are starting in addition to the programs we already have.
Yeah.
One of the things that emerged kind of was, we've got programs and we've got facilities, but what we don't have are actual people to fully staff these facilities and these programs. That there's a real lack of mental health practitioners, both the certified ones, the psychologists, the nurses, and everybody you need there, and then the support staff as well. Is that a kind of an accurate thumbnail of where we are now, and expand on that if you would?
It distinctly is an issue. I think a lot of folks understand hiring challenges anyway, but in mental health, we've really seen this worsen quite dramatically in the last few years. And so the public sector providers like McNabb and Cherokee and Peninsula, they've seen a doubling of their turnover rate. And that means, if they have such high turnover and they're not backfilling with folks that they've hired, then we're going to have some access problems, particularly for poor residents of the county and the city who depend on those entities for Medicaid, Medicare, or even uninsured type services. So that's problematic already. And while it's nice to get new programs announced and services, then the real problems or worrying starts to occur, because we've still got to recruit and hire and train some of the people that we need. And so one of the issues in mental health that's always been there, by the way, is when a vacancy opens at one place, we're usually robbing from another place to fill it, right? And so now we have two new hospitals going on, and you heard Liz Clary comment about, well, they have beds, 95 beds, but they can only staff for 65. What she didn't tell you was 10 years ago, they were at capacity for like 150 beds, but only staffed at 95. So now you see what the trend looks like. They're having trouble staffing. And that's why you have access with people waiting a while to get a bed in an inpatient facility. So they've got some problems. What's going to happen when the two new hospitals are fully open and online? Where are they finding their clinical team members and support members? So is there going to be further robbing from Peter to pay Paul here as we get these new services open? So that's a distinct worry that we have to have for the immediate time frame. But I think what we also need to have a conversation about is the pipeline to practice, because we have to get very serious about a local solution to get people in the pipeline who want to get their degrees to deliver these types of services, but then also want to choose Knoxville and Knox County as the place where they want to work. And that's going to mean big things to not only the treatment providers, but it's also going to mean big challenges ahead for like the Graduate School of Medicine at the University of Tennessee, or Quillen Dishner College of Medicine, the College of Social Work at UT, the College of Nursing at UT. We have needs for professionals now, but we also going to have much greater need 5, 10, 15 years out. And so they've got to kind of pivot a little bit, figure out what they have to be able to deliver to meet those needs. They're going to need to grow their enrollments, grow their faculty, classrooms, all of that, field placement experiences to be able to get those folks into practice.
Yeah, well, and that kind of ties into something that was in the report that I thought was really interesting, which you presented to a county commission in March. The fact that the lack, because we often talk about the lack of mental health care access for people who are low income, for people who are homeless. And obviously you were talking about some of the challenges for those, the public sector services sort of, but also that people with private, even people with good private insurance still have access issues because of kind of what you're talking about here, that there's not enough practitioners, or the practitioners who are there aren't taking new patients. So I thought that was an interesting finding out of that report.
Well, it's something that we found in the report, and then actually the commissioner did a very tangential confirmation of that problem as she presented Monday night. So what we knew was our experience in our call center here at the MHA is folks call us and they say, help, I can't find a place. I've called every provider listed on my insurance plan in the county, and no one is taking a new patient. So that is a real scenario that we face almost daily here in our office. But then the commissioner pointed to the fact that the majority of people who need care for a mental health issue in Knox County are insured by the private sector. That means they've got commercial insurance that they've purchased privately or is provided through an employer based plan. And so if they need care, and then you add the fact that we know so many networks are not taking a new patient, then you point to the fact that what's happening with our hospitals. Well, of course, all of that is going to default to the hospital, because the hospital can't really turn people away too easily. So can't find care upstream, right? Networks are full, can't find care. So where do you go? You go to the hospital. And it just, it screams the whole access problem is no longer just a public sector deal for the poor. It's for everybody. And the real scary thing is that, health insurance, if the networks are not adequate, it forces you to try to search outside of your network. And then what happens there is it makes mental health a luxury that folks can't afford. And the luxury is this: you choose out of network provider, you find somebody. Well, insurance companies smiling all day when you've done that because it costs them less to pay that provider. That means it costs the client more because they've got to pay the difference, right? And the insurance company is very happy. Now, if you can't find someone out of network, but you find someone who will take cash, again, the insurance company is incentivized all day for that to happen because they don't have to pay a claim. But you pay a lot more on the private cash side. And so then it becomes, can I afford that? And so mental health is fast becoming a luxury that folks can't afford just because we've got these networks that have no capacity.
Right.
Getting back to the staffing issue, one of the solutions that you suggested in the meeting, and it's also in the report, is that the local governments come up with a pool of funding to provide incentives to people who would want to come and work in those public sector providers that you mentioned. Talk about that a little bit, and also talk about if you've talked to county commissioners, city council members, and kind of how they've received that, because they're the ones who control the purse strings in the city and the county, and they are reluctant to add new programs in many cases. So talk about both the need for that you see and how that's been received so far.
Okay, so make sure I hit the second part of that. So the first part is it's a pipeline to practice type of issue. It's a talent recruitment. And in business, it happens all the time. They recruit folks, they offer incentives for people to come work at their organization. Doesn't matter if you're joining a big law firm, a big corporation, there are things there. But so the pipeline to practice is you've got folks that are getting out of graduate school or medical school, and they've got thousands of dollars of student loan debt. And it's not unusual for a social worker to arrive in the field and have $45,000 or $60,000 of student loan debt between undergraduate and graduate school accumulated. And physicians easily arrive in the field with more than $100,000 to $150,000 of medical school debt before they practice. And so there are some incentives out there to alleviate some medical school debt, that sort of thing. But my idea was, let's look at the federal program like that, and then let's figure out how do we change the playing field, because every community has the exact same incentive available to them, right? So we're competing with Minneapolis, we're competing with Atlanta, we're competing with Washington, D.C., and Knoxville is wonderful, has a lot going for it, but sometimes big metropolitan areas have a little bit of different appeal. So we don't have a level playing field there when it comes to that. So the thought was, well, what if we had a local pool of funds so that we're not competing anymore for those dollars? We've got local money that we can add to federal dollars that can be available for the incentives. And so instead of a physician being recruited to be a psychiatrist, having $35,000 of med school debt paid for with the federal program, well, what if Knoxville and Knox County had a separate fund where we could double that. Now, all of a sudden, we got people's attention, right? And it's not just one doc that you're going to have the attention of. You're going to have the attention of every college placement officer in medical schools across the country and the South. You're going to have placement officers for the colleges of nursing paying attention, or colleges of social work paying attention. And so that could easily be used to change Knoxville's fortunes in terms of recruiting talented mental health professionals to move to Knoxville. So we could get those folks coming straight out of their graduate or medical school programs. It also could be used to incentivize someone to relocate to Knoxville from Nashville, because now we're going to be able to assist them pay off those student debt, do sign-on bonuses, do retention bonuses, stuff like that. Literally handcuff folks, as I said in the meeting Monday, to choose Knoxville in the public sector, and stay for a minimum of 5 years. And so that's the type of thing that I had in mind there. The county commissioners have not really said anything pro or con about that, but there has been some intriguing conversation out of the mayor's office. They kind of like that idea, and they may have some dollars available, but we need to continue that conversation with them to see if those funds that they thought they might have were usable in this way. So it is something that certainly should be discussed, and bring in all the parties to see what else everyone can bring to the table, because it's one thing to say we should do it. It's another to look at how it should look in practice and how we shape anything that we want to do, and how the parties like the graduate schools of medicine or college of nursing and stuff like that could help shape the program too, because we have those things and they're local too. And boy, wouldn't it be nice for them to be on board right away from the start to say they're going to train local, but they're going to keep folks local too, and so that they could really be a strong voice in moving that concept forward too.
That's sort of an interesting analog to the grow your own approach that the school system is talking about with teachers, where they're trying to do that specifically with the University of Tennessee, but really kind of have students who go from Knox County schools into the University of Tennessee and then come back out to teach in county schools. Right.
And so, I mentioned Monday that one of the things I've become aware of is a growing list of former students from Austin East who have gone into the mental health field. And so, that's one of the things we should be doing, is we should be encouraging young people to choose the field of practice, to pursue these degrees that will get them the jobs, and then to be able to do the work here in our community. But I also think that it would be appropriate if the county were going to lead the charge and set up such a fund. I also think there would need to be a parallel avenue here to utilize some of those resources, and that would be to specifically target professionals of color, Black mental health professionals and Spanish-speaking mental health professionals, so we can recruit folks to really help our populations that have been traumatized and need some culturally and linguistically appropriate services moving forward.
Well, I have one more question before I let you go. Scott may have a follow-up too, but I just wanted to get a big picture sense from you of, I feel like the thing that I hear the most from people when they talk about mental health in Knoxville is Lakeshore. And this is all because of Lakeshore closing, and if only we had Lakeshore, and so on and so forth. And I know that Lakeshore, in fact, closed down over a long period of time. And by the time it officially closed, its patient population was pretty small. But I guess, what is your view now of, how much of an impact was the closure of Lakeshore? Did we lose something valuable there that hasn't been replaced in other ways? I don't know. I just feel like there's almost an odd nostalgia in a way for the era of like mass institutionalization.
Yeah, there is that odd nostalgia, and the notion of the closure of Lakeshore is the cause of any mental health challenges we have in our community. It's a hard one to take, and I'll tell you why. And I've got a little age on you guys and the gray hair to prove it. But the fact is, state hospitals have been downsizing for about 50, 60 years now. And so we started that process in the 70s and started discharging folks to the community. The problem was, back in those days, the mental health system, if you will, was in its absolute infancy. And of course, we weren't capable of, taking all the folks that were being discharged from the state hospital in those days and supporting them well in the community so they could make it. McNabb Center in 1970 was 24 years old. Cherokee was 15 years old, and Peninsula Hospital, our behavioral health services, had not even been established yet. So, we were in our infancy, and we were shifting from a hospital-based service system, and in those days, Lakeshore was the system. And we were shifting to community-based services. So historically, that transition has been going for a long time. And, you can't say the problems of 10 years ago with Lakeshore closing are the problems today, because what's happened with those folks over the course of the last 10 years, and I know folks want to point to it. Our friends in the homeless community often point to it, but the reality is, something may have caused someone to become homeless 5 years ago, and Lakeshore wasn't the cause. 5 years ago, we didn't have the hospital, so you can't say it's Lakeshore all the time. Now, yes, Lakeshore was a place. And we did need those beds. And so now it's nice to know that we're getting some beds established in our community. But, as I think our commissioners shared with us on Monday, when we closed Lakeshore, we saw about 2,000 people a year in the hospital. And now we're continuing to see people who need that service still be served either between Moccasin Bend or Peninsula or Ridgeview and Oak Ridge. We're seeing about 4,000 people served inpatient. So, folks can point to Lakeshore, but guess what? We're serving more people now than we were then. And we actually did a great job reinvesting those dollars in the community so that not only could we serve those people who still need to be served, but we could serve thousands more annually through other services that were created in the community or expanded in the community at McNabb and other places.
Yeah, that jives with what Commissioner Marie Williams said at the meeting when she talked about that. It almost is like they're serving more. The mental health providers are serving more people, and there's more state funding coming into the area, but it's diffused, and there's no one single institution like Lakeshore back in the day. So it's not as visible when those funds and those services are dispersed among many providers.
Well, the hospital was the face of mental health for about 75 years. And so it's easy to understand why so many people got enamored with the place in terms of it was the place, and we needed to lean on it for caring of our loved ones. But at the same time, the argument about, all these issues are because Lakeshore closed, a lot of times that's coming from entities that are not or were not necessarily funded with any of the $20 million that was reinvested in our community. And so kind of have to, weigh that one with a little bit of a grain of salt, I guess, and understand, okay, we hear you, but, the state did not invest in homeless services in those days. They invested in, outpatient mental health services and peer support services and things like that. And that's where they invested those dollars and have continued to invest those dollars. And it's paid off handsomely for the state too. Yeah.
All right. Well, I think we'll wrap it up there, but obviously these issues aren't going to go away. And I know the idea is that you'll continue to update that report every year to the county. Is that right?
Well, I believe we're going to have that opportunity. I do have a meeting tomorrow with some of the parties that I need to visit with on that. And I think the plan is we're going to keep the process going, and we'll be discussing some of our next steps. So stay tuned, and let's make a plan to circle back, and we might have some more news soon. Okay.
Absolutely.
All right. Thank you, Ben.
Thank you all so much.
All right.
Appreciate you.
Okay, well, thanks again to Ben Harrington for joining us this week, and definitely we will continue to track mental health issues in Knoxville and Knox County. Now we come to the reader question portion of the podcast. Every Thursday, we put up an invitation on our Compass Facebook page, available only to Compass subscribers, one of the many great benefits available to subscribers of CompassKnox.com. And we invite people to submit any questions or topics they'd like to hear about on the podcast. We did have one question this week from somebody asking if we could talk a little bit about the history of the Knox County Law Department, which is a sort of big and somewhat complex topic, and we're going to give a very short version of it here. But you can find more about it in the archives at CompassKnox.com, because this is an issue we've written about a fair amount. Knox County is pretty weird, Scott. Why is Knox County? Well, Knox County is weird for a lot of reasons, but politically and specifically in terms of the law department, Scott, why is Knox County weird?
Knox County is weird because Knox County has an elected law director. Virtually, I believe all the counties I don't believe there's another county in Tennessee that has an elected law director. Most are appointed either by the county commission or the county mayor. And that makes for some strange political dynamics.
It does, and a lot of smaller counties just hire out their legal needs to some local private attorney or firm. And then the other larger counties that have full-time law departments, as you say, those are appointed or hired positions either by the county mayor or county commission or the school board, or maybe they all kind of hire their own attorneys. But Knox County has a unified law department that serves all departments, all divisions within the county. It's established in the charter, and it is an elected position. And we looked into this a few years ago when there was a proposal on the ballot to change it to an appointed position. That's the fourth time there's been a proposal on the ballot to turn this office into an appointed position. And for the fourth time, people voted it down. And the way this usually gets talked about is, that they're trying to take away your right as a citizen, as a voter, to elect your own law director. which is a little bit of an odd argument because that law director does not actually serve you as a citizen. Now, they say they do. The Knox County Law Department will say, we are the people's attorney. But that's not exactly correct. They're really the attorney for county government. That's who they represent. They represent county commission. They represent the county mayor. They represent the school board. They do not represent me as a I can't, as a Knox County taxpayer, go to the law department and say, I want you to represent me in something. That's not how it works. But so it's an elected position, the law director, who runs the entire department, makes the hires of all of his own lawyers, and then assigns those lawyers to represent the different branches of government. And this actually goes back to the 1930s. And initially, it was a part-time position. And it really came about because there was some question at the time. There was a particular lawyer that county government had been dealing with and hiring, and some people in county government in the 1930s thought that they were getting ripped off by this private lawyer. And it was a faction of county government said, no, we ought to just have our own position here. And initially, it was part-time all the way up until the 1960s, and it was always just somebody who was in private practice here in the county. And then in the 1960s, it became a full-time elected position that carried over into the 1970s when they reorganized county government, and again when they reorganized county government in 1990 under a home rule charter. By that point, we had an elected law director for years and years, and it was just kind of brought in along with all the other parts of county government that were preserved when they created the charter. And this creates, various kinds of conflicts that we can all imagine and that we have all witnessed. For example, if one branch of county government is at odds with another branch of county government, the school board and county commission have frequently been at odds over the years. The mayor can be at odds with other people in the government. The same office is assigned to represent all of them. Now, to deal with this, sometimes the law director can choose to allow one branch or another to hire outside counsel. And we've just been through a big, long rigmarole with this, and the school board asking county commission for permission to hire outside counsel to help represent them in the mask case. And the law department didn't want that, and then county commission said the school board could do it. So the school board did hire somebody, and the law department agreed to work with that person as an outside advisor, but made very clear that they were going to continue running the case. And then, of course, in that particular case, as it worked out, that case got settled within a few weeks of that outside attorney being hired. Although we will still have to go back and see exactly how much that outside attorney cost. That's one interesting question. When any agency or part of county government is obliged to hire an outside attorney because of these conflicts with the elected law department, either they or the law department or somebody has to pay that. So that becomes extra money that taxpayers are paying for legal representation above and beyond what we already have with the law department. And the other thing that happens with an elected law director, as we've seen several times in recent years, the law department will say that it's not a policy-making body. They're just there to represent their clients in county government. But that's also not exactly true. It's true that they don't make policy, but we have certainly seen law directors, definitely former law director Bud Armstrong, and to some degree his successor David Book, taking positions that are just their positions. County Commission is going to be voting this month on a revamp of the Sheriff's Merit Council system that's entirely been brought to them by the County Law Department, because the County Law Department has decided, after 30 years of having a Merit Council established, in the charter and in county ordinance, that, oh no, it wasn't done right 30 years ago. And so now we have to, either redo it or it's going to be decided in court. That's something that was entirely brought by the law department. Had the law department not essentially changed its interpretation of that law, nobody would have to do anything. We also saw this with former law director Bud Armstrong bringing a lawsuit on his own, initiated by him, against the county's pension system because he disagreed with the way the pension board was interpreting the law. So the law department really is in a position where it doesn't create policy, but it can certainly shape the actual legal functioning of county government just by deciding that they suddenly think this one law or ordinance is legal or illegal. And, nobody can really gainsay them, or they can gainsay them, but it's legally complicated, as we've seen. So it's an interesting system,
to say the least.
And we did have a proposal to change it a few years ago, which was voted down. Of course, as you can read, if you go back and read our archives when we wrote about this, the language that was on the ballot, the last 2 times this has been put to the voters, the language that was on the ballot was written by the law department. The law department took it upon itself to write language that in both cases, the committees that actually passed the ballot proposal saying we want to put this before voters, the committees said they disagreed with the way the law department had phrased their proposal, because it was written to essentially say, should the voters of Knox County give up their right to elect a law director, which is probably the least palatable way you could present that to voters. And in both cases, the county law department, when those complaints were filed with them saying that they had misrepresented the intent of those proposals, basically shrugged and said, too bad. That's our power.
Yeah.
We get to do it. And so maybe there will be another proposal in the future. I think it's interesting, in the last few months, there's been a lot of discontent on county commission, on the school board, and in recent years, certainly County Mayor Glenn Jacobs. All of those bodies have had fairly serious conflicts and levels of dissatisfaction with their representation from the law department. And so who knows what that means for the future. For the near term, it probably means that the law department has some fences to mend. Menses to mend. This is what I hate about doing podcasts. I can't go back and edit out the typos.
Oh, tell me about it. I had an email from a listener and a subscriber who mentioned, had some constructive criticism about my proclivity to stutter and say when I speak, and I thanked him for it. It was good. I was glad. I know it's one of those shortfalls that I have, and I realize that's why I'm a print journalist and not I didn't go into radio or TV. Well, there's several reasons for that, but one of them is I can go back and revise when I make a silly error.
Well, our listeners.
That was actually kind of a funny turn of phrase. I wasn't going to say anything because I thought it was kind of funny. But going back to what you were saying though, yeah, there may be some discontent on these bodies, and there may be, who knows, down the road a move to once again to make the county law director an appointed position. But once again, if it does happen, it has to be done in a charter change, and the county law director is the one who drafts the question that goes on the ballot anytime a charter change is proposed. So we'll see if anything ever comes of this.
All right. Well, and for our subscribers, next week you will have another opportunity next Thursday to weigh in on any issues, questions, topics that you want us to cover. And now we will look ahead to the coming week. Basically, this is all budgets. We are in the home stretch of the city and county budget cycles. The city had their budget hearing on Friday. County Commission is going to follow suit on Monday with its own budget hearing, looking over Mayor Glenn Jacobs' proposed budget for the next fiscal year. And County Commission is going to gather at 3:30 Monday in the main assembly room to go through that. We don't expect any real fireworks there. Of course, the mayor is not proposing a tax increase, and so there's not a whole lot for anybody to be really mad about in this budget. And then Scott, on Tuesday, will get the resolution of the city budget, right?
Yeah, and it may be kind of an opposite thing there, because the city is proposing a property tax increase. As you mentioned, the hearings on Friday. There's going to be some opposition to the budget and the property tax increase. It passed on first reading on 7-3 vote. We had Councilwoman Janet Testerman, who is running for the state legislature in the Republican primary, This year, she is opposed to a property tax increase. I think two other commissioners, Sing and Amelia Parker, are skeptical. They voted against it on first reading. We don't know how that's going to play out after the budget hearings yet. We'll have a report on that on Monday, leading into the city's budget vote. I do foresee that there will be a move to reduce the size of the property tax increase proposal. I don't think that there will be one to eliminate it. There probably will be some proposals to lower it. I don't know about how much yet. A lot of that will probably be decided after Friday's budget hearings, when council members have a chance to digest what they've heard and can come up with some cogent proposals. That meeting is going to be Tuesday, 6 o'clock, and I anticipate it will be long, and there'll be lots of discussions and probably lots of amendments that will be raised. One of the difficulties that council has in making changes to mayor's budget proposal is they don't have the authority to go in and change line items. All they can do is change gross numbers for departments or funds. So they can, if they don't like a particular program the police department's running, they can't just cut that program out of it. They can reduce the amount of funding the police department gets, but they can't cut a program. And so that kind of limits what they can do as far as that goes. They can, though, like I said, they can address the bottom line, and if they lower the budget appropriations, then they'll have to lower the tax rate as well.
All right. Well, we will have coverage of all of that in next week's podcast, see what happens. And I guess that'll wrap us up for the week.
Yeah, like you said, it's all budget all the time this week. So we might be able to take off Wednesday, Thursday, and Friday after the days.
Wouldn't that be nice?
There's always news.
And we'll be there for it. And you can find it at CompassKnox.com. Thanks a lot for joining us.
Thanks.
Welcome to Compass Points, the weekly podcast for CompassKnox.com. CompassKnox.com is your best source for news and politics in Knoxville and Knox County. Your hosts today are Scott Barker and Jesse Mayshark, the founders of CompassKnox.com. You can find their daily in-depth coverage and subscribe at CompassKnox.com. The Compass Point podcast is brought to you in conjunction with Almost an Agreement. Almost an Agreement is a layman's attempt to get a handle on the workings in government and politics that we deal with every day. Check them out at almostanagreement.com or subscribe for free on your favorite podcast provider. If you'd like to learn more about the topics discussed on today's podcast, go to CompassKnox.com and subscribe for in-depth coverage and much more. And many thanks to William Wright for composing our theme song. Compass Points is a partnership of Barking Shark Media and Barbarian Productions, and recorded by Lord Seth A. Barber at Barbarian Studios, Knoxville, Tennessee.